It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
All right, our first guest is Dr. Linnea Welton, who is a hip preservation specialist, a sports medicine and orthopedic specialist from multicare.org, if you'd like to get more information. The hip, Shannon, I've had both mine replaced, so mine weren't preserved very well. But she's talking about how to, I guess, keep your hip in shape and keep it from getting to the point where you need something like that.
Yeah, Dr. Welton is not only a fellowship-trained hip surgeon, but she's also a sports medicine specialist. And she's going to talk about activities such as running and getting started in running and how to do that and approach that and develop that and progress your activities being safe. You know, if you've had hip pain, and your hip joints are pretty important with the weight distribution and activity. And if you get a hip joint that's inflamed or irritated, it can be a problem progressing on your activities. It can slow you down significantly.
All right, here's Dr. Welton and Shannon O'Kelly.
Dr. Welton, welcome. Tell us about your practice. You're an orthopedic surgeon. You work in mostly the hip area, but tell our listeners about your practice.
Yeah, so I'm dual fellowship trained in both sports medicine surgery as well as hip preservation surgery. So I do a lot of arthroscopic surgeries regarding things like ACL ruptures, meniscus and cartilage damage in the knee, but also a lot regarding pre-arthritic or sports-related hip conditions.
If I remember right, you're quite active as an individual yourself, so you enjoy cycling and running and all kinds of different activities. Is that fair to say?
Yeah, very true. I enjoyed doing long distance triathlons, so doing a lot of training for those, as well as rock climbing, mountaineering, backcountry skiing.
Okay, with this COVID-19 situation, a lot of sports or a lot of activities require social distancing, and what a great opportunity to engage in some of these activities such as cycling and running and getting outside where you can separate yourself from other people if necessary. So with these activities, running, cycling, first the question I have from a sports medicine aspect, how do I get started running, and is running good for me?
The answer to is running good for you is yes, absolutely. It protects against a lot of medical conditions such as obesity, cardiovascular disease, type 2 diabetes, even brain atrophy, and some cancers. We also know that it improves postural balance and overall musculoskeletal health. With regards to getting into running, the important things are getting a proper pair of running shoes and then making sure that you are slowly building into running.
When you talk about slowly building into running, maybe you can give us a simple recipe. If I'm not an avid runner, but I want to start, and let's say here I am, I'm 58 years old. Let's talk about me. I don't run that much, probably should. I'd like to get started. How would you recommend a person like me get started?
Beginning runners should start with a couple of runs per week, maybe 10 to a max of 30 minutes at a time. You should pick basically a location where you can walk comfortably, and don't increase your running time or speed for every 2 weeks, I would say.
So you want to get a nice location, probably make sure it's flat. The path should be somewhat, easy to run on and not rugged and not strenuous. Don't increase for 2 weeks. What are the things that initially we should watch for as we start activities? I mean, patella tendonitis, IT band syndrome. We hear about all those injuries with runners, but let's talk about maybe some things to watch for as you start to progress your running program.
So certainly the most common health risk of running is developing an overuse injury. So it would be if you are finishing your run or during your run, you start to notice pain, or if you wake up the next morning and you're having more than just generalized soreness.
How do I define? I mean, that's a really good question. That's a really good point, because patients often will work through pain thinking it will go away. I don't know that they understand the difference between maybe a little bit of exercise-related soreness, activity soreness, or actually pain. So is there a good way that someone can differentiate between, oh, my muscles are just sore, increased activity, or this is a problem I should have it looked at or be concerned of?
So I think any pain that doesn't go away within 2 days of a workout, that doesn't go away with taking an anti-inflammatory, and certainly if you're feeling a pain on one leg and not the other, is an indication that something might be wrong.
Dr. Welton, another question is running bad for my joints?
No, in fact, running is likely protective. Several studies show that moderate running can increase the building blocks of cartilage in the knee, and it actually reduces the inflammatory markers often seen in arthritis. Some studies have even shown that runners have a lower chance of having arthritis-related surgery than those that don't run.
Back with Dr. Linnea Welton and Shannon O'Kelly after this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
We continue our conversation with Dr. Linnea Welton. We're talking about the hip right here on Como.
Dr. Welton, again, thank you for taking time to talk to us about getting active. And that activity we're talking about today is running. You've discussed a lot of different aspects, getting started. Is it healthy for my joints? A lot of great information. The other question that comes up a lot is, when am I too old to run?
There's no age at which somebody is too old to run. In fact, statistics looking at marathons show that at least half of most marathon finishers are over the age of 40. And while as we get older, our finishing times tend to be longer and our pace is a little slower, running actually reduces the rate of age-related cardiovascular decline.
Good stuff. So you're never too old to start running. Just take it easy, progress yourself nicely. And if you do have any problems, I think the word is get it looked at by a physician like yourself.
Correct.
So when you talk about proper rehab as a surgeon, what is proper rehab after a surgery that you may have performed on a patient that wants to get back to activity?
Proper rehab is, one, getting normal motion, getting strength back, and then really when it comes back to getting more into dynamic activities, running, cutting, pivoting type sports, it's all about getting symmetric mechanics so that the surgical side is as strong, as agile as the side that did not have surgery.
So what we're dealing with after surgery is reducing pain, improving range of motion, then starting to work on strengthening, and then progressing back to return to play and simulating activities, if that's running, cycling, whatever it might be. But the opportunity to be active after surgery, particularly a surgery like in the hip that you may perform, is highly likely, and people can have good quality life and good return to activity.
I do a lot of hip arthroscopy, and so, that's where my passion and the vast funding of my knowledge is. And studies have shown that over 90% of runners who undergo a hip arthroscopy can return to running after surgery. And this is similar also for knee-related sports injuries like ACL ruptures and meniscus tears, et cetera.
And as we look at surgery, as we wrap up here, you at Multicare, the folks at Multicare are very focused on keeping patients safe and healthy, particularly with COVID right now.
Yes, absolutely.
Dr. Welton, again, thank you for your information. Thank you for your time. I look forward to talking down the road about hip and hip surgery and progress made in that area. Thank you so much for your time.
Yeah, thank you.
You've been listening to Dr. Linnea Welton talking about running and other socially distant activities we can do at this time of the year, and of course talking about its impact on the hip. And Shannon, socially distancing and things like that, stuff we've never had to be concerned about before. But, the hip, as you mentioned in our opening segment, is an important joint and something that sometimes we don't really think about. Everybody talks about knees and ankles, but the hip could be a big issue too.
Well, you'll know you have a hip problem if you have a hip problem, because it's pretty painful, and it can refer pain into your leg, into your groin, even into your back area. But Dr. Welton, the neat thing that she's doing, a lot of these hip surgeons today, they're working on hip preservations. Like you mentioned, you have 2 hip replacements, but now there's an opportunity to get your hip preserved through a minimally invasive surgery where they use a scope to go in and take care of the problem, so you don't have to have a joint replacement at that time. Maybe down the road you might have to have a joint replacement, but they can get you some years of quality movement, quality life with these minimally invasive hip preservation surgeries.
All right,
Does that
thanks.
make sense?
Yeah, absolutely. Thanks again to Dr. Welton. Our next guest coming up right after this time out on Como.